I took my children out into the front yard in the fall of 1992, raked the leaves into a pile, and then we jumped in them, and I didn't realize at the time that I was exposing myself to a deer tick biting me. And a few weeks later, I all of a sudden started having symptoms. I started out with a sore throat, swollen glands, felt like I had a cold. I went to my doctor. They did a Lyme test there at the hospital, and I was told it was negative and not to worry about it. I was really in trouble. The disease had disseminated in my body. It was affecting my brain. I couldn't sign my name. I couldn't dial the telephone. I couldn't do simple math in my head, and I'm a whiz with math that way. I went back to the doctor and I said, "Are you sure it's not Lyme disease?" They did another test. It still came back negative, and I continued to get sicker. So I went to see Dr. Cameron in May of 1993, and based upon my history and my clinical picture, he said I had a classic case of seronegative Lyme disease. So Dr. Cameron got me on oral antibiotics. I improved somewhat, but then I leveled off and started to slide. And then I went to intravenous antibiotics, and that was the beginning of a very, very long journey with Lyme disease. When you first start to feel this heavy burden that's literally sitting on your head lift, you can't believe how it makes you feel to be restored to a state of health, and it makes you realize how much we take for granted normally when we're well. And I remember how I felt when that started to lift from me, and I felt that I could function as an attorney with making use of all my skills, all my ability. I was very grateful.